So my name is Michael Bridges. I'm an assistant professor at Pacific University here in the School of Physical Therapy. Physical therapy is a broad profession. There are several settings that you can be in, similar to maybe engineering, where you may have civil engineers, mechanical engineers, electrical engineers. They're all engineers, but they have different focuses. So in physical therapy, you can focus on orthopedics. So what most of us will think of as sports, shoulder injuries, knee surgeries, all of the above, that sort of thing. A physical therapist can also work with neurological patients, so an individual that may have had a spinal cord injury, perhaps a brain injury, or even a stroke, amputations, really a huge gamut of the overall population. A physical therapist can have a great day. Depending on your role, if you're in a general outpatient orthopedic clinic, you'll be seeing patients throughout the day. Depending on the clinic, some clinics will schedule them every 30 minutes, some 45 minutes, some an hour. It's really kind of up to you and that clinic's treatment method and mentality. Other physical therapists may work in a home health setting, so they'll probably see fewer patients throughout the day because they have to drive to an individual's home, but they're probably in that individual's home for a little bit longer, maybe an hour, maybe 2 hours possibly, depending on the situation. So the life of a physical therapist can really vary depending on the specific setting that you're in, the specific patient population that you're working with, and really your overall goals. There are a lot of part-time individuals who maybe work 2 or 3 days a week because they so choose to spend time with their families. And there may be other individuals that have a full 40-hour day a week, cover high school football games, and have a running clinic on Saturdays. So it's a large variety of what you can do. Based on the setting that you're working in as a physical therapist, you usually will typically focus on a certain patient population. Similar to other disciplines out there, once you're more experienced, you can really start to focus on that specific population. We can treat anything from a child with cerebral palsy, a newborn with torticollis, so a neck tightening, to a grandma who's 100 years old and has had a couple falls, and everything in between. Your high school athletes, I've worked with high-level college athletics, to a 50-year-old with Parkinson's. So it's a very large patient population, and that's the great thing, is you get to meet a lot of great, wonderful people and help them in their various aspects of their life.